We all go through ups and downs in our lives. Sometimes we use the term depression or depressed to describe the lows we occasionally feel. Approximately 8% of adults will experience major depression at some time in their lives. About 1% of Canadians will experience bipolar disorder or manic depression. So what is the difference between clinical depression and the occasional blues?
Clinical depression is a complex of a few symptoms which have to be at least in 4 to 5 out of the 7 that we have identified. But the blues are just a feeling of being down for a short period of time, which could be triggered by an event.
Is there a genetic predisposition to depression?
Genetic predisposition is an important component of depression. They do find that people that have had a family history of depression may also have depression, but there's also specific triggers and also the types of personalities that people have that would elaborate a certain type of depressive symptom or a clinical depression.
And what is the difference between the seasonal affective disorder and clinical depression?
In a seasonal affective disorder, a patient is feeling down because of changes in the temperature or barometric pressure and or the daylight hours that the person sees. So it is almost unlikely that you would find this type of presentation in communities where you have access, light during the winter months. You may find it in areas that's further up north where the daylight hours are very short and people are prone to not feeling well because of exposure to more dark than light. So that's seasonal affective disorder. The outcomes are not as serious as a clinical depression, where one of the most important concerns we have is the suicidality or the ideation of suicide, where people will think about ending their lives just because life's not worth living. They have pressures beyond what they feel are controllable, whereas in the seasonal affective disorder, the person just feels a little bit down in the mood, possibly similar to the blues that can affect people from time to time.
Are there vitamins or foods that can naturally improve depression?
You know, there have been anecdotal and some studies reported that perhaps a herbal preparation called St. John's wort may have some effect on treating, but these have not stood up to the very rigorous trials that we have had for other pharmaceutical products.
Are there daily habits that can improve depression, such as exercise?
Exercise can improve depression a great deal. However, it should also not be done at a time when things like sleep are affected. So you have to have exercise early in the morning rather than closer to bedtime, closer to your supper or meals, because then patients can have an overlay from the exercise which may actually aggravate their depressive symptoms.
Joining me today is Brittany Brunskill, who's a certified personal trainer. As a matter of fact, we're at my home on the patio, and we're going to be doing leg exercises today, right?
Yes.
Okay, let's do a few.
All right.
They're so easy to do, even I can do them. So that means you can do them too. All right.
So standing right here like this, I'm going to take a nice big step backwards just onto my toe.
Just the toe.
Keep your heel off the ground.
Okay.
And then we're going to go down like this, and then return forwards.
Okay.
We'll go to the other leg. Big step down.
Oh yeah, this is a little bit more
push back.
challenging.
Great.
Okay.
So remember to keep that nice tall posture. There we go. Try and be...
I'll have to add this to my little regime that I told you I was doing in the morning.
Now we can really focus as well on the muscles in the back of the body.
Oh, yeah.
Your glutes, when we're pushing off here, really focus on those. Those are very, very effective for improving your posture as well.
Okay.
So
how far should we go? Just like how far should the Leg go to the back.
If you have a nice soft floor, I would recommend going down really every now and then, enough that you touch the floor.
I got a little further out there. Okay.
Touch the floor every now and then you'll really feel just how far down you can go.
Okay.
Because otherwise you sort of feel like you're going low, and then you go find the floor, and it's kind of like, whoa, it's way down there.
Okay.
So, and then the step needs to be far enough back that you're not sort of pushing your hips forward like this.
Okay.
So yeah, that's perfect.
So you definitely feel it.
Yeah.
Okay.
Nice. So same sort of idea. We want to make sure that there's no lateral movement there with the knee, and that we're able to really maintain all of that alignment.
Okay, thanks, Brittany. Well, I think the viewers enjoyed this. I did. I know I'm going to add it to my regime. Hopefully you will too. We'll see you next time. Once depression is recognized, help can make a difference for 80% of people who are affected, allowing them to get back to their regular activities.